Gage Pramar here, crushbackpain.com. Today we're going to talk about core stability. What is core stability? Why is core stability important? And what is core stability training? If this video helps you, leave me a thumbs up below. Subscribe to the Crush Back Pain YouTube channel. Core stability. So core stability is exactly what it sounds like. Basically, here's your core. It's this area around your waist, and it's making that stable. Now, core stability is important because the more stable this area is, the better able you are to use your arms and your legs to do different things. Everyday tasks, picking up your child, moving a couch, working in the yard, playing sports, lifting weights. You need a stable, rigid core so you can generate force, power, torque with your extremities, with your arms and legs. With lower back pain, this is especially important because the way that the spine is built is just like we just now talked about. And here's our spine, looking at it from the side. Here's your lower back down here, your lumbar spine. We've got the pelvis, we've got the hip joints. But you need a stable base so you can do things. If this area down here moves too much, your lower back, then there's more wear and tear through the discs, there's more wear and tear through the facet joints, and eventually that can lead to tissue irritation, inflammation, and pain. So basically, 9 times out of 10 when you look at somebody's MRI, it's going to be L4-5, which is this level here, or L5-S1, which is this level here, that's going to have a herniated disc or a bulging disc or facet joint arthropathy or facet joint hypertrophy, whatever. But the reason that 9 times out of 10 it's L4-5 and L5-S1 is because those levels naturally have more movement. So they're just going to show more wear and tear on imaging. Now, we've talked in the past about how even people without lower back pain have imaging findings similar to people with lower back pain. And again, that's because L4-5 and L5-S1 have more movement, they get more wear and tear, you generally have more tissue breakdown at those levels. So if you have lower back pain, it's especially important that this lumbar spine, particularly the lower motion segments, are nice and stable so you're not getting too much motion down here in the lumbar spine when you're just doing everyday things. So let's grab a different model here so you can see it a little bit better. So here's a lumbar motion segment. We've got the vertebral bodies, it's the white part here, it's the bones. We've got the disc in red. On the back here we have the facet joints. This is where the motion comes in combination with the disc. And then we have this yellow part that's the spinal cord. So if you have too much motion down here, when you're just doing everyday things, walking around doing stuff, that leads to tissue irritation and it eventually leads to pain. So with core stability training or core stability exercises, the whole purpose is to get the muscles of the trunk to stabilize that lumbar spine so when you're moving, you get some motion down here, but it's not excessive. And research shows that core stabilization training actually reduces lower back pain. If you go and get a lumbar fusion, which is the most major back surgery you can get, all they do is they use hardware to stabilize the motion segment. Core stability training uses the body's muscles to stabilize the lumbar motion segment. A lot of times when people think about the core, they just think about the abdominals, the rectus abdominis here in the front. The core encompasses all the muscles. So you've got the front, you've got the rectus abdominis, you have the obliques, you have the quadratus lumborum, and in the back you have the multifidus muscles, you have the paraspinals. So it's all the muscles of the trunk. So an effective core stability training program doesn't just train the abs, the front part of the core. It trains the front part of the core, the lateral or side part of the core, and it trains your back muscles as well, and also the glutes, because the glutes tie into the thoracolumbar fascia and help stabilize the core. So core stability training is especially important with people that have lower back pain because most of the time, one of the main drivers of that lower back pain is too much movement in those lower lumbar segments. So if we can effectively train the trunk to stabilize, that motion is decreased so they can do things, they can do everyday activities without that extra motion. They don't get that tissue irritation and the pain goes away. Now, with stability training, a lot of times you have to do some other things before you get to the point where you're training the core. If you have a disc herniation, sciatica, you may need to do some other specific exercises. But even once you get past that point, even people that have had disc herniations or disc bulges, it's important that after they get past the point where they no longer have the leg symptoms, the sciatica, it's important that they then get into a good, solid core stability training program so they have a reduced risk of recurrence rate. And that's another thing that core stability training does, is it reduces the likelihood of future lower back pain happening. And the research shows this. So in the next video, we're going to talk about some specific core stability exercises that you can start doing right off the bat. You don't need any special equipment. And the exercises we're going to talk about are especially effective because they train the core, but they do it without putting too much force through those lumbar tissues. So there's a lot of good core exercises. There's a lot of ways to train the core, but if you're training the core muscles in a way that puts too much force, compression, shear force through the lumbar spine, you're just going to irritate those tissues and you're not going to get the outcome you want. And that's what happens a lot of times, is people are doing exercises that do train the core, but they're putting too much force through the lumbar spine. So those tissues that are irritable, the discs, the joints, the nerve roots, they're not able to heal. They're not able to get that tissue irritation down to a level where it's not painful. So they just abandon the core exercises and think it doesn't work. So it's really important to do the right core exercises the right way. And then you progress to other exercises that are more functional, that have more carryover to everyday tasks, everyday activities. So that's what core stability is about. It's important, especially for people with lower back pain, because of the reasons that we just covered. And we're going to cover core stability exercises in the next video. And then the video after that, we'll cover some core stability exercise progressions. If this video helps you, leave me a thumbs up below. Subscribe to the Crush Back Pain YouTube channel. And feel free to drop me a line here on the YouTube channel and ask any questions that you may have.